Hello everyone, this is Chadi Alraies from NCVH 2023 in New Orleans. I'm really privileged today to be with the chairman, Dr. Craig Walker, to talk about the main purpose of this meeting is peripheral arterial disease, the pandemic of this disease and the burden on the health system. Dr. Walker.
Huge problem. Mary Yost estimates that the incidence of peripheral arterial disease in today's world is 27 million people in the United States.
Wow.
Now, that's a much bigger number than some of the prior estimates, which were based on much older studies where our population was smaller. But there are many reasons why this is bigger. To start with, diabetes is epidemic, much more diabetes than we once had. Secondly, our population is aging. One of the fastest growing segments of our population are octogenarians, people over 80 years old. And so the demographics have changed with this as well, and we have more minorities, and they have a higher incidence of disease and a higher incidence of amputation and death with these diseases. So we have to do a better job with this. We have to improve disease awareness, and we have to make the diagnosis, and we have to do preventive measures. Every one of the patients need that. They don't all need a stent or an atherectomy, but they do need to lower their cholesterol. They do need to quit smoking. They do need to exercise if safe. And they do need to recognize that they're at higher risk of death from heart attack and stroke. By doing this, we can save lives. You know, I can't put my finger on a heart pulse. It's inside the chest. But I can touch the pulse of any of my patients in their foot. If that pulse is not there, I've identified a sick patient, because sick legs are almost never attached to healthy people. That sick leg should be a clue that we've got someone who needs care, and we should have very, very careful follow-up. This meeting was really one of the first to establish that link and to say, wait a second, we have to pay attention. It is an important part of the physical exam to check pulses in the foot. If they're not there, we need to examine more carefully and possibly even do other screening tests to make sure this person is not at risk of having a heart attack or stroke at the same time. There's great opportunity to improve healthcare and to lessen costs by doing this, but it's going to take effort, education, and that's what NCVH is about.
Absolutely. I saw a lot of initiatives here done just for the patient, the physician only, how to treat the problem. There's a lot of focus on how to identify the problem, diagnose it, and then how to treat it.
That's right. It is not just one part, it is all of those parts. And the first part, though, begins with simple medical therapy. Let's try to prevent, or let's try to lessen the likelihood of it getting worse. Often, nothing more is needed, but we can save lives doing that.
Dr. Walker, thank you so much as a pioneer in this field, and also who is the person who is an ambassador for all these patients with PAD. Thank you so much for all you have done, you and your team. Watch these videos and others on the NCVH YouTube channel. This is Chadi Alraies from NCVH 2023. Thank you so much.
Thank you, Chadi.
Thank you.
So nice.
Thank you.